Joining us now, the director of the National Institutes of Health, Dr. Francis Collins. Doctor, welcome back to Fox News Sunday.
Glad to be with you, Chris. There's a lot to talk about this morning.
There is indeed. Let's get to it. So let's start with that FDA advisory panel, which, as we've said, supported the idea of booster shots for people 65 and older, or those most at risk, but rejected the idea of booster shots for the general population. Here's what President Biden said last month.
The plan is for every adult to get a booster shot 8 months after you got your second shot.
Dr. Collins, is the advisory panel right? Do you now agree with them on this limited booster program over what the president was proposing last month, the general population getting boosters, which he said was based on advice from his medical experts, including you?
You know, Chris, I think there's less difference between where we were in the middle of August and what the advisory committee said this past Friday. They did encourage and vote for the administration of boosters to people over 65 and those at high risk of exposure. Those are the people who would be most likely to reach that 8-month period, because that's how we prioritized initial immunizations back in January. So I don't think there's huge differences here. I think the big news is that they actually did approve the initiation of boosters. And remember, they're taking a snapshot of right now. We're going to see what happens in the coming weeks. It would surprise me if it does not become clear over the next few weeks that that administration of boosters may need to be enlarged. Based upon the data that we've already seen both in the U.S. and in Israel, it's clear the waning of the effectiveness of those vaccines is a reality, and we need to respond to it. But they looked at where we were on Friday and said, here's where the data is convincing to start now. And we'll see what CDC says later this week.
But just to be clear, what you're saying is you still think, and I understand the people further down the list, younger people, healthier people, didn't get their vaccines as early in the process. You still think that we're going to need a booster program for everyone?
I'm not sure about absolutely everyone. We'll have to see what they say ultimately about the youngest individuals because of concerns about benefits and risks. But I will be surprised if boosters are not recommended for people under 65 going forward in the next few weeks. But we'll wait and see. You know, Chris, what you're seeing here is science playing out in a very transparent way. This is the way it ought to be. I'm a little troubled that people are complaining that the process isn't working for them. The process is to look at the data, have the experts consider it, and then make their best judgment at that point, recognizing that the judgments may change. If people want an absolutely authoritative statement about here's the right answer, well, that's not what our country is all about. Move to China, you'll get it there.
Yeah, but let me ask you about that, Dr. Collins, because President Biden said, he announced on August 18th that they were going to start the plan. Yes, he did have a line about, well, we pending approval of the FDA and the CDC, but he talked about starting a booster program on September 20th. That's tomorrow. And he talked about giving it to all people, not just a limited group. Now, back during the campaign, he talked a lot about follow the science. Isn't announcing a specific date and a specific plan for the general population before any of the regulators, the FDA, the CDC, have approved it, isn't that the exact opposite of follow the science?
Well, he was basically responding to a statement made by 8 physician scientists, including me, including the head of the FDA and the head of the CDC, saying we had looked at the data and it looked as if boosters were going to be a good thing for Americans to start to utilize. Recognizing in that speech, he did say CDC and FDA's advisory process has to kick in first. You know, I guess I'm a little troubled, Chris, about all of the buzz that's happening right now about whether the process was perfect. Of course it's not perfect. No process ever is. But have we lost track of the goals? The goals here are to try to protect Americans from dying from this disease. 670,000 have already. It does look, from the review of the data by people like myself, that we are going to need to provide boosters for people at risk in order to keep this surge from beginning to affect even those who are fully vaccinated. We're trying to do the right thing, trying to look at the data as it evolves, recognize things are changing day by day. Maybe we ought to be talking more about that than about whether the president said this a month ago and FDA said this on Friday. Let's try to get the science right and do it transparently and openly so everybody sees what the process looks like.
Let's talk about another aspect of this. President Biden is convening a COVID summit for the world this week in New York as part of the UN General Assembly. The latest statistics are that 57% of the world's population have not received a single dose of the vaccine. Is it moral for the president to be pushing a third booster dose for Americans when most of the world hasn't received a single first dose?
Well, I think this is a false choice that's being put forward. We have, of all the countries in the world, done the most to try to get doses to people in low and middle income countries across the world. We've already sent out 140 million doses, committed to another 500 million that are coming, contributed $4 billion to COVAX. So we are very invested in that. And watch and see what happens this week when the president meets with other countries. There may be more information there as well. The most that we might be talking about as far as boosters between now and the end of this year might be 100 million doses. It's a pretty small, modest number compared to what we are already sending out to the rest of the world or have committed to do so. And again, let's be clear, the United States, of all the countries in the world, has been the hardest hit with this. And if we were to step away from the need to actually protect people for whom the vaccine protection is waning and say, well, we just can't help them because we've got to send all those doses overseas, that wouldn't be responsible either.
OSHA is currently writing a rule, it's probably going to take a couple of more weeks, to mandate that businesses with more than 100 employees mandate vaccines for them, or at least, if not, then they have to get a mandatory test every week. Meanwhile, 24 state attorneys general, all of them Republicans, say that they plan to sue to block this mandate to private businesses, saying that, one, it's government overreach, and two, that it is simply fostering vaccine resistance. Don't they have a point, Doctor?
Well, I'm not a politician and I'm not a lawyer. I do know that the law that Congress passed requires OSHA to take action when there is grave danger in the workplace of harm to employees. COVID-19 represents a grave danger. So a reasonable person would say they are not just supposed to act, they have to act in that space, and that is the justification for this rule. And I would just hope that those attorneys generals who are protesting against this would step back and ask themselves what is really going to be the best to save lives, and are they on the right side of history or the wrong side of history by trying to resist this?
If the president wants to mandate vaccinations for basically all Americans, or as many as he can, why is there no mandate for people coming across the border illegally? The numbers are really bad, that people, illegal immigrants who come across the border when they leave federal custody, 1 in 5 tests positive for COVID. The White House press secretary, Jen Psaki, was asked about that. Take a look.
More people are vaccinated, whether they are migrants or whether they are workers, protects more people in the United States.
But it's a requirement for people at a business with more than 100 people. It is not a requirement for migrants at the southern border. Why?
That's correct. Go ahead.
Well, we didn't get much of an answer from her, so let me ask you, Dr. Collins. No mandate for illegal immigrants crossing the border who have a really high incidence. Why not?
I can't answer the question, Chris. I'm not in those conversations. I know that vaccines are being offered to people in that situation. I guess you're asking why is it not mandated? That would have to be a question for someone else.
From a public health point of view, would that be healthier for the country to make sure that every person coming across the border illegally gets a vaccine?
Well, I would say whether they're coming across the border or they're somewhere else in the world, yes, as a public health person, I want everybody to be vaccinated. And if a mandate would help with that, let's do it.
Finally, pediatric COVID cases are rising. At one point, I saw that it was 1 in 5 of all the pediatric cases in the country. Where do we stand on getting approval to vaccinate children 5 to 11, the next group in line to be vaccinated? Where does that stand? How soon do you think it's going to happen?
Well, first of all, kids 12 to 17 can be vaccinated. Unfortunately, only about half of them have been, and so there's an area where we have an opportunity to make progress, especially with schools open. The data submitted by Pfizer to FDA for kids 5 to 11 is supposed to arrive in FDA's hands later this month. I know they will work 24/7 to go through it and try to assess whether it's time to grant an approval, and that will happen in weeks and not months. But exactly giving you a precise date, I don't think that would be a smart idea. But it will be coming, certainly, and I know many parents are worried about that. And I'm glad we're talking about this as well, because the best way to protect those kids right now is to have the people around them vaccinated. So, Chris, before we leave off here, could we one more time appeal to those 75 million unvaccinated people who still have not gotten their first dose? I know you've been very positive about the need for that. Let's not miss the chance one more time to say that's the most important thing we should be doing about COVID-19 right now, today, Sunday, September 19th.
Dr. Collins, thank you. Thanks for your time, and we'll be tracking what happens next with those booster shots. Thank you, sir.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.